is that we have access issues, is that there are barriers. There are barriers related to funding, program, systems, stigma. What I'd like to do is I want to deviate a little bit from our program. I'd like to have each of you give a short description from your perspective about the key barriers to getting care, the problems with access, and then I'd like to open it up to the audience. We don't have a lot of time here, folks, but I want to try to get the audience to ask a few questions that we can field. So we can start down there with you, ma'am. And you can talk from the family perspective. What are the barriers that are most problematic for you and all of the people you represent?
Is my mic working? Yep. I'll begin just real briefly because I've been in this arena as an advocate for more than 20 years as a profession. My background is public relations, but I really began as a mother. And this is 27 years ago. My then 8-year-old son had a psychosis, and back then, it may be hard for some of you to remember, children didn't get sick. So it was definitely the mom or something else going on. And so getting care for my son, my oldest of 3, was a real challenge. And I know that's probably not popular in the current gun culture, but I'm from Tennessee, and I used to call myself a double-barrel shotgun. One side was I was a mother, and the other side I was an advocate. So what I learned very quickly was, what do you do not to rely on the system because it didn't exist? And sometimes, frankly, I think we really expect this. This may not be politically correct either, but sometimes we expect the system to kind of provide for us. It's very important that we get what we deserve from our communities. But in my experience, there was no system. There was one child psychiatrist in the whole state. And there was just nothing. So I had to get really innovative and build relationships. And I really, to this day, believe that's really a key, is finding those champions. I call them my healing team of angels and saints, who could help me help my child and figure out how to navigate what was a beyond difficult situation. And he was one of those children that didn't turn his anger outward, he turned it inward. So suicide for an 8-year-old was like a constant battle and what we struggled with. And I'm going to move to the bigger question, but I did want to say I think it's very important. I was working with HBO on a film that's coming out next week actually on this issue. And I think it's really important that we not lose hope, because you just never give up. And if you don't, things will happen, some things will go bad, but sometimes one of the barriers we have is that sometimes I think we are afraid to share the success stories too. And in my own experience, my son has done very well. He had struggles, but made it, went to college, works for Microsoft, makes more money than I do. Don't know how I feel about that. But is married, is a father, has friends, is a great brother, a great son, and a great human being. And so sometimes it's hard to share that, because sometimes people almost get angry with the success story, which is really weird. So I feel like there's a lot of wisdoms to teach from people who have managed to navigate. Back to the barriers issue. I think one of the biggest barriers is really lack of community. And I'm not going to talk about systems barriers, because there's a lot of experts here who can really talk about what those are, and we know what they are. I began my career at NAMI as a PR director in Tennessee because I didn't want my son to have the same outcome that I saw other people have. 20 years later, we're almost having the same conversations. And it makes me really sad. So what I've done is dedicate the last couple of years of my professional work, much to the credit of my CEO and bosses and board of directors, to really reaching out to people outside of the mental health community, because I think it's going to take people in corporate America, brands, private sector, thought leaders, influencers. I work with a group called, my name for them is FAMES, Film, Art, Music, Entertainment, and Sports. Making sure that those conversations are happening vividly, loudly, everywhere they can be, so that the more stories that can be out there, the more we can normalize and eliminate some of the shame and the secrecy that we have about talking about these conditions and these issues, that the more we're going to begin to combat the barriers that exist. And the last barrier is really around, I think, our challenges in working with the next generation and young people. And I say our role as older, wiser maybe, advocates is to be encouragers and encourage them. They have great ideas, better than I could come up with. So switching the role of saying, we're going to bring you into our world, and maybe thinking about how can we encourage you to be the leader. We need you. You know, we're going to run out of gas at some point. So those are my thoughts. They're really not systems barriers as much as they are community, you know, just cultivating empathy, cultivating champions, and cultivating a community that's honest and open and caring.
Honest, open, and
Thank you very much. Just to reflect on your last point about the role of the young people, as I was saying in my opening remarks, we actually have a couple of young people here to finish this thing off, and I'm dying to hear what they have to say, and we need to bring them in to our design work, as you said, and that's what we're doing. In fact, this whole month is focusing on young people and how they can inform our system and demand a new era.
Yeah.
Speaking of systems, I'm looking at my colleague Toby Ewing, who's the Executive Director of the Oversight Accountability Commission for MHSA. And your role is to help oversee and push the transformation of mental health services across the state. So in a brief period of time, if you might identify the key things that you would like to see get knocked out.
Well, first I'd say I think we need some more double barrel shotguns. Because that's how change happens in our community. You know, so I'm not a clinician, but when I talk to clinicians, there's this overwhelming sense of, in most cases, in the vast majority of cases around mental health needs, we have the tools and the strategies and we know how to support people. There are exceptions and there are outliers there. But that's not happening. And I think that the state of California needs to establish a policy and a practice that everybody who needs care gets care as a foundational step, right? We don't have that today. And consistent with what you heard from Congressman Kennedy and Mayor Steinberg, we need to figure out the right strategies in terms of the role of the private sector, insurance systems, the role of the public sector. I think we've, unlike other areas, we've made it very easy politically and in our communities not to solve this problem. We need to make it easier to solve the problem and harder to fail. Right now, as the stories that we've heard today, the stories we see every day in our communities, in my own family, it's very easy to sort of get caught up in the disappointment and to see that as acceptable. And there are lots of us who are recognizing that that's not acceptable. Use your analogy of that double barrel shotgun, right? But as Mayor Steinberg said, if this was someone we saw with a physical health need, it would be absolutely unacceptable. But when it comes to mental health care, half measures are enough. And we have the tools, we have the resources, we have the creativity. The commission, consistent with your comment, we, in February, John, you were there, we engaged in an innovation summit, first ever innovation summit for mental health. We brought together county mental health directors, youth, providers, family members, and we reached out to California's innovation sector, in part because we wanted them to help create permission for our public sector leaders to try new and creative things. But we also wanted to break down some of the barriers of understanding and stigma. And if we step back and think about the resources that California has, their fiscal resources, but it's also organizational capacity. It's the creativity. It's the ability to bring new people into the conversation. I think the biggest barrier we have is we're not doing that sufficiently yet. We're continuing to anticipate that the system we have, if we can just grow it bigger, will be able to address our needs. We can't buy our way out of this problem in terms of public mental health dollars. What we really need to do is change the way our system is designed, change the way we think about expectations, be very clear in what we're trying to get done. And if we start with this idea that everybody who needs care gets care, and I'd say that thanks to Mayor Steinberg, the Mental Health Services Act says the goals we have for our mental health system in many people's minds aren't even mental health goals. They're goals for humans. As someone said, this is about human needs. It's about being safe. It's about having housing. It's about having our families intact. It's about children succeeding in school. It's about having a job. In my family, I have a family member, when he's working, we know he's well. When he loses his job, that's when he hits those stress points. That's when we're concerned about suicide. That's when we're concerned about his mental health. And so if we reframe this conversation in terms of what it actually is we're trying to accomplish for people and for families, I think we can think differently about the resources we have and we can get there.
Thank you, Toby.
That was great. Kurt, you come from a really, really important position here in the conversation at disability rights, and the fact that that access to care must be a civil right. And I would love to hear your perspective on this conversation and the issue of barriers through your lens.
Thank you, John. Thank you for the invitation to join all of you all the way down here in Los Angeles. It's always a pleasure to come down here. I think you hit upon what I think is a very important and key point of our organization, and that we believe is essential to really changing the culture of behavioral health treatment in the state and nationally. And really, I think that is that mental health is a health issue.
Yes.
And mental health is a disability issue, and mental health, therefore, is a civil rights issue. And we need to think about mental health as indeed a civil rights issue and bring some of those strategies, tactics, and importantly, understanding to the discussion as we talk about reshaping, restructuring, and resourcing the entire system statewide. Another thought that I think is related, maybe Toby and I have been spending too much time together, but oftentimes what can determine beyond just that public understanding is the political commitment and then the political structure behind that political commitment to make the system work. And Prop 63 and a lot of legislation following, before and following that, have really helped set up a structure, but not a structure right now that I would submit contains the leadership that it really has to have at the highest level to make that happen. For, I think, a whole host of political reasons, decisions were made that locally we would design our systems and have those systems closer to the communities. There are upsides and there are downsides to that. And the downside is we've got 58 different systems, some with greater capacity, greater sophistication for leadership, and like I think Dr. Sherin brings to you all here in Los Angeles. Every county does not have that. And from our perspective, it's really a disappointment to see that the level of services would depend on a person's geography. And so I think for that reason, we need to continue to keep in statewide leadership some sense of leadership, direction, and commitment to the program. And I guess one other piece that's maybe more on the practical side, that as we